Good morning, good afternoon, good evening, wherever you're joining us from. Thank you so much for taking time and being here for the State of Systems Thinking in Healthcare 2026 event. This event is hosted by the SI Healthcare Hub. The purpose of this event is to launch the paper that we've been working on for the past few weeks. In this session, we will unpack the core themes of the paper, map out the current ecosystem, and explore how we can better apply complexity theory and systemic design to shift paradigms in healthcare. So for this session, your host is Jos Colchester. He's joining us from the Netherlands today. He is a founder of the SI Network and works as ecosystem builder with the SI Network. We also have Rosina as a co-team member. She's not able to join today, unfortunately. And then we have Ushma, who's also the co-team member at the SI Health Hub. She is also going to speak during the event. And then myself, Roma, I'm joining from India. I'm the program manager and innovation facilitator with the SI Network. So we are super excited for you all to be with us today while we launch the paper. So the event will go on for 75 minutes. We will have questions and answers at some point. So please feel free to drop in your questions in the chat box. As we go along, we can pick it towards the end. And then the session is being recorded. So in case you have missed any part of it, you can always revisit on YouTube, LinkedIn, and on our website to find the recording. And also we are live streaming right now on LinkedIn. So hi to everybody joining us from LinkedIn. Thank you for being here. Even for the LinkedIn members, feel free to drop your questions or anything that you want to share in the chat box in the comment section on LinkedIn, and we'll definitely pick it up during the session. So that's a little bit about the session. And today we also have guests who've contributed to this paper. So let's welcome them together. We have Ushma, who's the CEO and founder of Ripple Foundation, which empowers system leaders with intelligence for proactive health. So thank you, Ushma, for joining us. And then we have Yukpang joining us. He's the advisor board member, professor, and director of health system transformation and population health architect. Now let's welcome Yukfan. Thank you for being here, Yukfan. And then lastly, we have Andy Wilkins. He's a futurist, keynote speaker, conference chair, and podcaster. He's also a founder. So let's welcome him as well. Thank you so much, Andy, for
Thank you
joining
very
us.
much. Thank you very much.
Of course. We're super fortunate to have such amazing panel here who will answer some of our questions and who also contributed to the paper. So looking forward to the session. And the agenda is quite straightforward. We start with introduction, and then we'll have a little bit of overview of the paper, how it is structured and what's in it. And then Joss will take us to the presentation of the paper. And then we will also have question and answer with the guests. We have set of questions already on the board for them. So we'll ask those questions, and then we'll also take your questions from the comment section later. And then we will have outro. We will wrap up with your feedback and how to join the hub. So moving on, for the icebreaker, we just would like to have you reflect on what does a systemic approach to healthcare mean to you? So for that, you could either type it in the chat box what you think about it. And from here, I would like to request Joss to walk us through the presentation. Over to you, Joss.
Excellent. Thanks a lot, Roma. Good to see everyone here today. It's exciting to share this paper with you and host this conversation. Yeah, maybe that question you hold it as we go through and you reflect upon it based upon what you're hearing. Because I think it's still an open question to some extent. What does it mean to apply all these ideas in healthcare? I think it's definitely a work in progress, is what we've discovered from doing this research, and it's about connecting the dots and breaking down silos. Okay, it's a holistic approach to healthcare. Very good. So yeah, I'm going to start off here with some of the highlights from the paper and how we organized it and, thought about approaching this before we hear some initial thoughts from our guest speakers. And the paper is here. Maybe Roma, you could drop a link in the chat. so that people can discover it. It's a preliminary review, I would call it. It's the first time we're doing this, and it unearthed a lot of kind of thinking and brought together ideas that we thought were out there, but kind of brought them together and made them a lot more coherent. I'm gonna, highlight these six kind of main takeaways for us, and then we will move forward. So we'll go into details of the paper a bit further along, so we can unpack all of that. Um, but yeah, it's really trying to get this overview of where are we, the state of systems thinking in healthcare, and trying to give some broader view of the ecosystem. Um, and this may be the first time, it's the first time we're doing it. It may be the first time that anyone's doing it. So it's very much an experiment, I would put it down as. But I think there's some really interesting learnings from it. And let's just jump into those and start straight from the top. So six of them here, maybe starting on the top left here, and yeah, some of these are intuitive to us, particularly this first one. I mean, we hear it all around us, growing calls for change in healthcare and even systemic change. And that's been rising. I mean, these key takeaways, I will substantiate them as we go through the paper with some data and more information, but these are the kind of headlines here. Um, but yeah, we hear this growing calls for systemic change in healthcare. Contemporary key challenges, such as rising chronic diseases, are increasingly recognized to be systemic and needing new approaches. So again, there's awareness around the systemic nature to these challenges, and that we actually need, partial approaches aren't sufficient. There's growing interest in systems thinking, and I think that's been there for a number of decades. Of course, when we talk about healthcare, we're talking about many dimensions, and we're talking about multiple different actors. That's part of this, right? Looking at it from multiple different perspectives, and we'll touch upon those, of course, all the way from administration to, pharmaceutical companies to nurses and doctors and so forth. So it is a very multidimensional phenomena we're dealing with here, different actors looking from different perspectives. But for many areas, there's growing interest in this. And we will be digging into that when we look into the paper. Um, yeah, I mean, definitely across the board, you see this lack of connections between organizations. There's a lot of communities of practice out there. There's a lot of interest, and there must be thousands of communities of practice across all healthcare systems and different organizations. How connected up are they? Is there a place you can go if you want to join the community of practice for all of this? Um, so there's kind of a lack of connection between all these different interest groups and these different communities. There's a lack of methodologies. There's some we will be looking at today. We actually have Tom Inns with us. We'll be looking at one of his toolkits that he develops, but there's a few out there. But is there really a comprehensive kind of toolkit for this? Um, that's something I would say is still lacking. There's fragmentation about what it means. These ideas, if you are, just getting started to learn about this, where do you go, and what is the kind of core set of ideas that you learn and that's shared and so forth. So yeah, good news and challenges and opportunities here, which is what we're going to be exploring today. The opportunities are growing interest, growing awareness, and growing demand, I would say. But then on the kind of supply side to match that, we have a lot of fragmentation. We don't have kind of coherence around ideas and methods and so forth. So that's a little bit of the headlines. We'll substantiate and dig into more of that as we go through the paper. Before we hear a little bit from our speakers in terms of their thoughts around where we are, just say a bit about how we structured this paper and what are we actually evaluating here. So to some extent, we're using this word system thinking, systems innovation, interchangeably here, although they are quite differently. We are evaluating the two of them. Systems innovation, it's about a transformative kind of innovation and change in healthcare. It's about applying systems thinking and complexity complexity theory, trying to understand healthcare as a complex adaptive system, as a new framing, moving away from the kind of mechanistic, bureaucratic, reductionist approach that we know well from the modern era, and actually bringing in a whole new set of ideas about, living systems, complex adaptive systems as a way to frame and look at healthcare systems in a new way. Beyond that, there's, a lot of things around trying to better understand healthcare systems, the different actors through mapping and finding intervention points. There's a need for, health ecosystems and collaboration and new ways of working across boundaries, across silos, understanding each other in different perspectives so that we can find ways to collaborate and so forth. And ultimately, we're looking for a transformative kind of change. Um, a lot of the foundational principles of healthcare are really being brought into question at this time and revisited. And there's a lot of questions about how we actually transform instead of doing incremental changes. And this is what we're looking for when we say systems innovation and systems change in healthcare. Not going to go into all the kind of theoretical, ideas around that. We have other papers, but it's a more networked ecosystem relational approach to healthcare. It's person-centered, but also system-centered. It's about open emergent systems. And it's a much more holistic, should we say? Someone put it in the chat there. It's not episodic. It's not just about sickness. It's also about well-being. It's continuous over a whole life cycle and ultimately moving from the reductionist paradigm to a systems paradigm. And that's what we're talking about when we say health systems innovation. And we're looking at the ecosystem of different things that need to come together to really bring this alive and make a more transformative kind of change happen at the kind of scale that's relevant, right? So that's looking all across these different dimensions, from research that's unlocking the ideas to methodologies and tools for people to be able to go about doing this, awareness so that people know about it, places to learn, to connect, to build capacity, organizations to be able to do this, projects, demand for it, funding, so on and so forth. And that's what we're going to be digging into in the paper, looking across those different dimensions. And just to reiterate, it is this ecosystem concept. It's saying that, just as it takes a village to raise a child, it takes an ecosystem to bring a whole new kind of paradigm and a transformative change into healthcare systems. It's not going to be one actor, it's not going to be the nurses, it's not going to be the management, this or that. It's going to require a whole new ability to unlock these ideas and put them into practice. And it's going to require all of this kind of working together in some sense. So it's looking at those different dimensions, but then, of course, there's the question of how do they fit together? How do they work together? So that's just a little bit of starting ideas for you in terms of the headlines, in terms of what we're talking about when we say health systems innovation and what we're evaluating here. But maybe to jump into here a little bit from our guest speakers. Our first question is really hearing from them. How would you characterize where we are today with the challenges we face in healthcare systems and the need for systems thinking and systems innovation in healthcare? Maybe I'll start with you, Yuk Feng. You had the starting position in the paper and you wrote this great introduction. So I'd love to hear your thoughts on this. Yeah.
Hi everyone. Yeah, thanks Josh and Roma for arranging the session. Very happy to be here. Yeah, so I think I have been in healthcare 25 years or so, and really I think the issues around having a better health system, the issue about having more patient-centered care, better value-based care, and that leads to population health management. I've been working on this problem for like the last 12 years, trying to reorganize the northern health system in Singapore. And a lot of the challenges I feel really stem from everybody wanting to do this very, uh, as should I say, lofty idea of trying to get to person-centered care at a better value point, and whole system population management, but not quite a lot of understanding about how to go at this task uh, in a coherent way, right? So I think there's a lot of goodwill in healthcare systems, in hospital systems, in care and social services. There are lots of goodwill there. But the difficulty really is when everybody wants to do good and everybody wants to do very similar things, but in different ways, in different subsystems, in different institutions, there really becomes a lot of duplicate work, a lot of coordination issues, and we seem to be repeatedly doing the same things again and again, right? We keep innovating at the front lines. We keep getting care staff, hospital staff, uh, clinic staff, or healthcare professionals. We keep getting the same people to innovate on the changes at the front line, forgetting very often that the work that needs to be done is in the other subsystems, in governance, in IT transformation, in workforce transformation. So I think why is that, right? That's the big question. Why is that happening, right? And the lofty goal of becoming more person-centered, more community-centered, a whole ecosystem of partners coming together to care well. Why isn't that happening, right? So I think there is a disconnect between systems thinking as taught in the universities or as taught in a systems thinking class or as taught in a leadership class, right? And we are able to appreciate all the MBA classes, all the lessons on systems thinking, design thinking, complexity management, almost as if it's a theoretical topic, right? But then translating it into everyday practice and then working on the same systems, right? You are a system thinker for your system, the nursing system. You are another person is a system thinker for a medical system. And then the finance is a system thinker for the finance system. But are we thinking about the same system, the system that will care for people and population, right? How do we apply systems thinking tools to look at the same system, analyze systems behavior, right? And then analyze the stakeholder awareness and understanding of issues there. And then from there, find paths that lead out from there. I think that is the difficulty. We are all somehow schooled in systems thinking, complexity management at the leadership level, but not quite making that practice transition. So I think that's kind of like my very short quick take on like where's the state of healthcare and then where's the state of systems thinking practice. We need a lot more translation to practice. I think that's my the last 12 years my experience has been. And I want to discuss this with everyone here, there's lots of experience in the room. Yeah.
So kind of an implementation gap, as they call it to some extent, but also connecting across all the different systems thinkers, I think is what you're saying. Okay, over to you, Ushma. How would you characterize where we are today with the challenges we face in healthcare and the need for systems thinking?
Yeah, perfect. Thank you very much, Joss and Roma, for organizing the session as well. Very grateful to be here and to speak on this very important topic. I think I really first, of course, agree with Jörg Van's perspective here on the implementation gap. I think I'd even go so far, and maybe I'll just give a bit of context of where I'm coming from, because I worked in the healthcare industry for a very long time. So I do have the perspective or worked in the system, but always from the perspective of the industry. And I think there, one gap that I see that I don't know if it's bigger than the implementation gap or lower is hope, the hope gap. One of the because when we often think about systems thinking, then I find that it can be very overwhelming because, as Jörg van, you had mentioned, it's not only finance, it's not only the front line, it's also technically, and this is a challenge that I always meet, it's other system. Health is not created within the healthcare system, or which is very disease centric, but it's actually, conversations with, for example, food investors or investors in the food sector that need to take responsibility of the impact of the innovations that they invest in to scale. And when I hear then sentences that, oh no, sorry, I'm in the food sector, not in the health sector. And that's where we have a bit the
a hope gap to say that is it possible to widen my system's boundary to something that becomes bigger, because then it's too complicated for me to manage or too complex for me to take responsibility for or understand its implications. I am not a doctor, but I have implications to the health system. So that's also lots of cultural mindset that we need to tackle, I think, as well. So hope gap is the one that I would go with in general.
And also the connecting the dots, but not so much inside the system, across different systems. And of course, I think you touched upon the complexity that arises when you try to do that is part of the challenge, isn't it? Can be pretty overwhelming. Health is so pervasive, and you're talking about so many different systems that that's still a frontier in terms of how we manage that complexity and kind of even make sense of it fully. Yeah. Great. Thank you, Ushma. Andy, I'll pass it over to you.
Thank you very much, and glad to be here, especially sharing the stage with Yuk and Ushma. And as you not be surprised to hear, I fully concur with what both of our previous speakers have said, and there's a lot of wisdom in there. I've spent a lot of my time in the last few years looking at this whole picture of whole systems transformation, whole systems innovation. And I've been fortunate enough to do work on looking at the future of technology and future of systems, but I'm also a researcher, which has allowed me to sort of go out and sit with people struggling with various diseases to understand the question, what's it like to be you, looking back into whatever we call a health system and seeing the gaps, the things that we miss when we look through a more medicalized lens. And this sort of medicalized mechanistic model that we've been describing is predominant in our health system. And as Manjit and others have put in the chat, it is largely a sickness service rather than a health service. And yet 80% of the reasons people get sick don't lie inside what happens in healthcare. It lies what happens outside. So I think part of this challenge and this kind of reckoning is that we kind of known that, but now we've got to get serious about really thinking about not just treating disease, but creating health. Because the lowest cost way of being able to manage disease is not to pour money more into managing disease more effectively, as important as that is. It's removing or reducing the amount of sickness that we need to treat in the first place. And so we really need to go from a sort of national sickness systems to really national health systems that broaden that system boundary that Ushma was talking about. So at one level, there is a kind of reconstituting of what we mean by health, not just to be traditional sickness and care services that help people fall over when they fall over. It is about generating the conditions for health more broadly, of which managing sickness is part of a bigger story. But I think also we've got a question here of complexity of the health system as well. There are multiple nested systems of activity going on. Right the way from what happens in an emergency department. You could say that's a complex system. We can do stuff there. What happens in a particular clinic dealing with a particular body part or organ is its own local complex system. And one of the things that I've been quite conscious of is that the mechanistic system that we have, which is so siloed, so fragmented, so short-term, so transactional, it is a sort of factory production line of delivering care to body parts and parts of people's health. If we just keep our ambition of helping that system to do its work a little bit better, we'll be missing out on the bigger paradigm, which is how do we go from silos to systems of health? So this nested piece feels really important. And when you look at that nested piece and you look at it through a broader frame, let's go up the stack a little bit. Take diabetes, for example. And I've done a lot of work with researching, sitting with diabetics, what's it like to struggle with diabetes? What you see is that that's a complex challenge for people to manage. It's not just the physical condition of it. It's how do I adjust my life? How do I live with it? What do I eat? How do I manage the relationships in my family and friends? There's a whole suite of things that constitute living and managing with diabetes. So the problem is a complex whole. Yet when we go back into our system, what we see is we've got a bunch of parts that deal with bits of that challenge that are not joined up, that are not holistic. And sort of almost systems thinking 101 is that you can't solve a complex problem, a complex whole with a part. And we've got a system made up of parts, and we throw parts at complex problems and wonder why we can't solve them. This is the invitation to come together in more complex wholes to address more complex problems. Now, if you go up from diabetes to why do we have more chronic disease, which is not just diabetes, but all of the other conditions as well, what we see is a more complex set of challenges that invites more complex coming together of multiple actors to address that. We cannot solve that from optimizing parts. We have to think more holistically. And if we go up another level to whole population, where it really cashes out, what we're seeing at the moment is our populations around the world in general are getting older, sicker, more expensive to treat. The Office of Budget Responsibility and other health economists are saying, if we keep doing what we're doing, which is managing the disease bit in silos, and not doing anything about that sort of health side, our health systems are going to increase in demand 3 to 4 to 5% per year. Go forward 10, 15 years, we doubled the cost of our healthcare systems. We bankrupted the country. So there is, from a paradigm point of view, continuing with this siloed, reactive, body part way of doing healthcare is going to drive us all off the edge of a cliff, as well as not being able to address the challenges of the quality of life of the people that we serve. So this is really an invitation for a whole paradigm shift. And this is the work that I do. Like, if we keep doing what we're doing, we'll keep getting what we're getting, and we're all going to drive ourselves into the sand or off the edge of the financial cliff. So really, this is a moment of reckoning. And so this question of how do we go from silos to systems of care has never been more important than it is now.
Yeah, it is a sustainability crisis in the true sense of the word, isn't it? And I think what I'm hearing here is a very realistic picture about the complexity challenges, the complexity gap. That, like, if we're really going to do this, if we're really going to be able to expand to meet this challenge, it is about the complexity of connecting across the dots, inside, outside, and across all dimensions, as you're saying, Andy. So let's come back to that question about, what are the opportunities and what are the challenges to actually leaning into and embracing that complexity towards the end. When we come back to the speakers, thanks a lot, Andy, Ushma, Yukving. I'm going to move on. We have about 45 minutes left, so going to share a little bit of the contents of the paper and then come back to our speakers, and we'll also have time for you people to share any questions towards the end. So this is the paper. I'm not going to go into all of it. It is relatively light, so encourage you to read it. Roma dropped a link in the chat there. Again, looking across these different dimensions and asking what's going on there, essentially. So if we started with research and the foundational ideas here, and I think there's been a lot done there over the past decades, and we just highlight some of them here, some of the main kind of publications, some interesting ones. There are links in the book, so the paper it does provide a good kind of database of resources and links, so you can go and explore everything, the people, the books and publications and learning resources and so forth. These are just a few. Peter Jones published one around designing for care and systemic design in healthcare. This was a pretty seminal one. It's a while back now, from the WHO, Systems Thinking for Health System Strengthening. That was an important one. We have one from the Health Foundation. There's many others that have been exploring this question of, how do we understand healthcare systems as complex adaptive systems? The crossing the quality chasm is a good one. But welcome you to take a look into those. I mean, there's a lot of publications out there. How coherent are they in really bringing together the ideas to give us a good sense-making framework for health systems as complex adaptive systems? So again, I think this goes back to the idea of fragmentation in ideas in across organizations and so forth. But definitely resources out there, and that's definitely growing, I would say. So looking at tools and methods, those are ideas, and these are how we go about doing this. We highlight a few toolkits here and then kind of case studies, interesting case studies. I mentioned earlier on this one here from Tom Ings and co. It's the ecosystem mapping toolkit, and workshops. Had Tom join us for our conference in London and run a really interesting one here. So it's essentially about trying to create a tube map, shall we say, of the experience of the patients as they go through a healthcare system. I know I did that, a year or two ago as a patient, and it can seem pretty overwhelming. This is a way of trying to map the patient's kind of experience and ecosystem. So patient ecosystem mapping methodology has been developed to enable the healthcare system to build a London Underground style map of the patient's pathway within which they work, and then use this to reflect on potential improvements. So trying to map out the system in some sense. One Health, there's a number of frameworks around that, trying to create a more holistic, planetary health, One Health frameworks for that, social determinants of health, shifting away from diseases and thinking about the overall context within social, economic, all different dimensions within which health is created. There's a couple of little spotlights and case studies. Interesting one here. Esther Care Model came out of Sweden in the 1990s. Not sure if you're familiar with it, but it was this I think it's a theoretical, or whether it's real, experience of this person called Esther, who serves as a symbolic persona representing all the elderly patients who juggle multiple doctors and care services. And the idea is they take an approach where they put Esther at the center of the whole experience and always have her thoughts in mind, she being a symbolic elderly patient. And is this contributing to helping her, and kind of, I guess it's patient-centric in some sense. And that's one case study or little illustration from Sweden. Maybe you've heard of this Buurtzorg model in the Netherlands, quite famous model, neighborhood care system that is expanded substantially to be able to offer a much better and cheaper quality care in the Netherlands than a conventional system. Another interesting one, Nuka in Alaska, and it's a ground-up community-owned healthcare model developed by the South Central Foundation for Alaskan Native People. And operationally, Nuka organizes into tightly integrated multidisciplinary teams where primary care provides behavioral health specialists and traditional healers work side by side. And again, it's trying to bring it back to the kind of community customer owned or user-centered kind of model. So welcome you to look into those in the paper. There's a couple of examples of how different tools and methods have been used. The Three Horizons in Shine in Scotland to think about winter planning for the NHS. In Fife, and systems mapping. Maybe you've seen this one from the UK government, somewhat overwhelming map of the obesity, all the different factors affecting obesity, co-design. The Collaborative Chronic Care Network is a healthcare model that unites patients, families, clinicians, and researchers as co-equal partners to co-design, test, and implement solutions for chronic illness. So some of the tools and methods. We'll stay moving along, not to take up too much time. So here we're looking at general awareness around these new ideas and approaches. And as I said before, this whole concept of a broken healthcare system is certainly rising. This is data from Google's Ngram going back to 2005. And it's illustrating this call for health systems change. And this one's growing interest, as I was saying originally. And actually, there's a very good and extensive review of 6,000 systems thinking publications over the past 3 decades, reveals a distinct pivot away from more hard engineering physics focus to most rapidly emerging themes today are centered on healthcare. So again, substantiating what I was saying earlier about growing interest in this area and growing research in this area also. Maybe Roma, to the mirror board. Yeah, if you could drop that in the chat, Roma, thank you.
Yeah, I just
Thank you. So some of the key challenges that are, driving this need for system change, I think we've maybe heard them already, or we will hear them later on. The epidemiological shift towards, chronic diseases, lifestyle diseases, non-communicable diseases, systems fragmentation. We hear a lot about that, misalignment of incentives are some of the challenges that are driving this call for systems change in healthcare. Where is it being introduced? In medical education, habits of a systems thinker, for example, global health policy. We saw the WHO's publication back there in clinical quality and safety. So those are some of the areas that it's being applied. That's a little bit about awareness in connecting. There's quite a gap here, as I was talking about. There aren't necessarily places to go and connect with others and to discuss and share and potentially collaborate around this. We just highlight one, which is the International Society for Systems and Complexity for Health. And they have a website, something of a community. It's a little bit academic. They host a conference. I think it's biannual conference on this topic, and that's a little bit of a gap there, I'd say, around connecting. As mentioned, I'm sure there are a lot of community of practices. I bump into to those, but they're inside organizations. So I think there's a big need for a space outside that hosts, conversations like this in a more kind of open way for people to connect and collaborate. Here we're looking at individuals, some kind of key figures. We have some of them here today, Andy and Yukfeng, but there are many others that you may know. I mentioned Peter Jones, that book on systemic design in healthcare. Karen is here in Amsterdam, City of Amsterdam's public health service, where they took a whole systems approach to tackle complex urban health challenges, specifically childhood obesity. And Jacqueline's here also in the Netherlands. Joe Chimp was founded this organization back here I mentioned and hosts the conference. Helen Bevan, you may well know. She's quite a known influencer coming out of the NHS. And we actually looked at some of the themes she talks about as a kind of an interesting indicator of, what people are talking about and what interests them, because she's probably the biggest influencer in this space. So she talks a lot about social networks. So she's particularly interested in how do you make, large scale changes happen within healthcare systems. And a lot of it's kind of moving away from, top down change management approaches towards more human-centered, emergent, and complexity-informed approaches to transformation, particularly within healthcare and care systems. So she talks a lot about social architecture, social networks as kind of drivers of change. Emphasize the immense power of peer-to-peer influence and the necessity of building the informal connective tissue, the social capital within organizations to make sustained transformation possible. She uses a lot of social network analysis to try and understand who are the actors in the system. How can we go about, influencing change within the system through those social networks? She talks about modern change leadership and agency, moving away from this mechanistic kind of change management approach that we're familiar with, the top-down approach, and enabling teams to speak up, challenge the status quo, and navigate the unpredictable, messy middle of organizational change. Says it's not top-down, it's not bottom-up, it's both at the same time, and you get a kind of messy in between when you do that. Systems thinking and continuous experimentation. Instead of large scale rollout plans that frequently fail, you should take a much more iterative, adaptive, and experimental kind of bottom-up Trojan mice, as she calls it, instead of a Trojan horse, safe to fail experiments that can, initiate change. So that's some of, I might encourage you to follow Helen Bevan if you're not familiar with her. She hosts really great conversations, Twitter channel, LinkedIn. I'm going to stay going. So it's looking at some of the organizations. You may be familiar with these. The Health Foundation in the UK, the Swiss Tropic and Public Health Institute has quite a big group around systems thinking. Planetary Health Alliance, NHS Horizons, EIT, sorry, European Institute of Health, trying to build an ecosystem across Europe for health systems change. Those are just a few of the organizations. Moving on to who's actually interested in this. So this is analyzing followers on LinkedIn, who are the main people, health practitioners and clinic leads. There's a lot of academics and systems researchers, public health and global health policy professionals, healthcare strategy, transformation, innovation executives, and then a lot of designers, human-centered design, service designers, systemic designers, and so forth. In the paper, we kind of go into some of the challenges that they're exploring. Maybe I won't go into them now. I think we'll hear a bit about them in the conversation. And that is most of the contents of the paper. We then highlight some interesting initiatives and encourage you to read through these. We have actually looked at one or two in previous sessions here. We talked about the care blocks in Bogota, in Colombia, trying to build a kind of a decentralized network to support the people who support their peers. So it's, like women, particularly in this situation, who are left to look after their parents and children and so forth. And the idea is, can they create these local blocks that are actually supporting those people to provide support and care within their communities? And there's a few little bit about that, a little case study there. Community health work in sub-Saharan Africa. And the final one is actually in Spain, Social Forum of Care, where they're trying to, the Care Lab in Catalonia supported quite a large scale initiative to really gather people's input into how the health system could be shaped and created going forwards. Deep listening and co-creation kind of as core to that, gathering over 250 people in Barcelona, using co-creation tools to create a safe environment where medical professions, academics, home care people all came together and synthesized the findings into concrete political guidelines and so forth. So there's a few case studies. Don't want to lecture all day. Leave you to take a look at the paper. It's in the chat. It's in the chat there, and move on to hear a bit more from our guest speakers and any questions you might have in the chat there also. It's really picking up from where we left off last time in terms of, okay, that's the need for it. But where do we go from here? How do we approach that complexity we were talking about? And how do we build capacity both for approaching that complexity, sense making in that complexity, but the kinds generally, there's more than that, right? There's need for collaboration, there's need for kind of crossing divides and so forth. How can we build that kind of capacity in healthcare? Maybe I'll start with that question. Ushma, would you like to try and take that? How are you working on that? Right? Yeah.
Thank you so much for the question. I think what comes immediately to my mind is language. So it's a bit on what like educating seems a bit top down sometimes. So I think having conversations, but really sensing what is of value to the party that we're speaking to, and what are common terms, what are definitions of terms that I am using when I speak to them about systems thinking. Maybe they have a different perception of systems, or as you Fang had also mentioned before, it's also about which system are we talking about, right? In this conversation, these are I think language is something extremely important to identify and for it to emerge. Also, the more conversations we have, the more also sometimes tension we have, and the more we engage with that tension as well, the more the definition will kind of come about as well. There is one study that even showcases that if two people speak together, but they're very aligned in terms of values, that they are not as efficient in the process of collaboration in comparison to two people that might already be a bit in tension, but in like tension, but because they are in tension, they actually go back to the basics. So what does this actually mean to you? And then you redefine the fundamentals of it, and then you can actually create great collaborations from that, and that's actually much more efficient if in terms of something emerging. If I may
Yeah,
use.
but there also needs to be spaces for that, doesn't there? I mean, it's not just, I mean, language that doesn't pop out. It's not just a theoretical, like that's actually people getting together, and there needs to be spaces and the right kinds of space. I mean, there's lots of conferences, but if they're all medical, experts, then it doesn't necessarily create that. It's creating the right context for people to come together and kind of unusual suspects to meet each other and try and negotiate their different perspectives and so forth. No.
Yeah, absolutely. And in terms of environment, often, like sometimes in corporate, you call it psychological safety, right? Do you feel comfortable to discuss your definition of whatever is being spoken about? Do you feel comfortable in expressing your opinions or your experiences as well? And also like an environment of lack of judgment. So often, when we, at least in industry, sometimes it happens that okay, I go to this meeting with a specific goal and a specific this and specific target, and these are the agenda points, and this is what I want to achieve within this conversation. And if I don't, then it's not a success. And being kind of, you need a mindset of like an open-mindedness in terms of some colleagues have called it the principles of irrelevance. So it's okay to go into a meeting where you don't see the connection immediately, but you are open to exploring what could happen out of this connection. And as you mentioned, Joss, as well, what did you call it? The unusual suspects. The unusual suspects to collaborate. Yeah.
Mm. Yeah, great. Okay, I'll pass that on. Yukfeng, would you like to pick up on that question? What's needed to move forwards from here? Yeah.
Yeah, Josh, I think fantastic work by the team. The collection is a treasure trove of methods, systems, and models. I think it's great work. I will certainly be reading a lot more into it. The it's interesting you point out that there are so many successful models like Birdsong. I think it was highlighted in the chat, but a really great model. Um, there are also a lot of failed models, right? I think those don't make it up, they don't bubble up, and we don't hear about them. And closer to my own home, right, in North Singapore, I actually built a unified care model, attempting to model out what should be the North Star care and services model that people and population will desire to have. And then I realized it's not just about the care model, because all these successful models that you have talked about, right, like South Central Foundation in Alaska, right, the NUCA system, or maybe even the Birdsong system, they do not just transform the care system. They actually have some sort of a scaling approach, some sort of governance transformation going along. But all we usually get to hear about with the short 10 minutes we have is about what they did in the care system, right? So I think that's really where the magic sauce or the missing magic potion is. So in my own work, I describe this as the interdependent set of models that really need to be put out by systems thinker or health system transformation stewards. It's not good enough to just articulate a unified care model or a care model of how you want doctors, nurses, or even public health specialists, community stakeholders, how you envision them in the ecosystem of work. That's not quite enough for scaling. It's enough for getting some things done, getting some care transformation going, but it may not scale, right? So the issue here is not about fast or slow transformation. It's not about transforming or not transforming. I think if we take a long perspective and we give ourselves 30 years or 100 years, we will transform, we will get there. But the issue is how can we, with the help of systems thinking and complexity science and implementation science, how can we, with better leadership development, how can we accelerate and shortcut that change, which is what Helen Redmond is talking about. What's that Trojan horse that can help people cut through all the chase, right? And like Tom Ince is working on methods, right? So I think the question here is, what is that set of methods that will help people accelerate and cut through that difficulty? And in my view and my experience, I think what really helps is a set of interdependent models, with the care and services model being the North Star of what you want that to be in a transformed state. And that could be different for different countries, right? So Andy's talking about in the NHS, we really need to get to human-centered, community-centered, preventative rather than sickness systems, right? So if that is the North Star system, then what is the financing system model that you are going to operate on? What is your informatic and data science model that you're going to operate on? What's your workforce model? Now, you're not going to get all of them right. In fact, you're going to get all of them miserably wrong on day one. But the fact that you have a set of interdependent models to guide action so that more people than just one team can be innovating. More people are innovating, but towards a set of interdependent models that some system have put together, right? And in my view, I think that is where systemic visualization really, really helps. Put all your models in one place and then let people see the tensions, let people see the similarities, the differences, right? And then they can then innovate with better information, right?
Yeah.
When you can increasingly see the system, then your actions become increasingly serving the whole. That's the principle we are after. So my last comment is really going to be on, so where does this take us, right? Systems thinking, teaching, complexity teaching, MBA schools are full of that. Certainly, even my university, we teach that. But what is needed, I think, is the translation of this into practice, that new leaders feel that systemic visualization is not a theory, that these tools that we use to map systems, visualize systems, they are available and we must use them and we must put them in action in a place where people can see and can innovate with better information. I think that's really the practice gap that I was talking about earlier. Yeah.
Yeah, I think yes, I think what you're saying is it's really got to create value for them, isn't it, Yugfang, or else they're not going to adopt it. And it's that in their job, in their practice. Otherwise, there's going to be that implementation gap. So they've really got to come down to ground, really deliver value kind of in a concrete way. And I think before what you're saying is that there's got to be a whole infrastructure there, like as you say, governance and finance and recruiting and all of this. And I guess part of that, maybe what you're saying also is you can't, a model that works in one place, you take it to another, and that infrastructure isn't there, it's not going to work, right? So there's a lot of stuff going on underneath the hood, as you're saying. Yeah. Okay, maybe I'll pass it on to you, Andy. Would you like to pick up on this?
Yeah, and fantastic insights there from Yuk. And I want to build also what Ushmo said about language, because if we're honest, we look at the healthcare system, whether it's at organizational level or departmental level, everyone is in a silo. We're all in silos. And each silo is being asked to optimize itself. And therefore, it's interested in what it can do to further and sustain itself. So built into this top-down hierarchical mechanistic superstructure in which healthcare sits is this orientation to optimize my thing. And of course, downing tools and working with others to do other things can be seen as a distraction from optimizing my thing. So how do we get a paradigm shift to come together as systems is super, super important. And when we look at optimizing, it's not just optimizing for my local interests. A lot of optimization is also very short-term focus. How do I hit my quarterly or end year numbers, which constrains my ambition and my interest and my sort of potentiality to innovate to something that can incrementally improve my short-term position in my silo. And now we're about to put AI into the mix, which people may use to optimize their silos even more. So we've got some headwinds in the system to coming together in more systemic ways. And this is where I've found Three Horizons very, very valuable for a number of reasons. Three Horizons, for those who don't know it. Horizon one is all, in the way that I use it, is a state of being. Horizon one is all the stuff we do today. We're in our silos, we're transactional, we're short term, and this is what we do and this is what we deliver. But if we take a look out into the real world, we see our populations getting sicker. We see expenses going up, demand increasing. So no amount of optimizing that Horizon one siloed infrastructure is going to give us a healthier population. Let's accept that. Let's down tools on Horizon one. Let's reimagine what we could be doing in Horizon three. How could we use the capabilities and the resources and the new technologies and the new understandings? What could we build that could speak to the real needs of the population that we serve? So it's an act of imagination. It's an act of stepping out of your world and thinking about that future. And the more important point there is what would need to be true for that future to work. So it's not just a vision, which is word salad on stilts. No, what would need to be true? We need to share information across organizational boundaries in real time. We'd need to pool budgets and work collectively on projects. We'd need to act more dynamically and adapt and work as teams. We need new skills. And is that a desirable place to be? Yes. Well, how the hell do we get from this siloed mess to that future is the systems transformational journey. And by bringing multiple actors together to down tools on the immediate, to think about the future and what could be and what would need to be true, invites them to transcend their interest in optimizing silos, to participate in a bigger system story. Something that has hope, something that could really make a difference, something that brings us together. And therefore, what's revealed is there's something of that systems transformation journey. And back to Ushma's point, one of the values of doing this, it gives us a common language to talk about what we do. What we see in silos at the moment is that you speak English, I speak Chinese, and you're working on this sort of clock speed with these kind of incentives. I'm working on another one. It's like trying to mix oil and water. It doesn't happen. We get frustrated. So it's through looking at this shared future that gives us a shared language, shared hope, a shared sense of what we're being called to become, to connect really to the challenges that are out there. And the final piece I'll just leave you with is that from the work I've been doing, it's very hard to engineer yourself into an integrated service that delivers better population outcomes. What helps a system is spending some time out there with the real world, speaking to and understanding the lived experience of people. What do they need to be able to live well? What do people need to start well, live well, age well, die well? Do we even know what that means? It's partly physical health, it's partly mental, it's partly social, it's partly environmental. It's a combination of all these things. Until we've understood what drives health and poor health and good health, we won't have a deep enough understanding around which we can configure our system to truly speak to that. So there's a real depth of understanding of what it is that the population needs from us as a system, such that we can come together and configure and attune to the realities of what we're being called to do. So the attractor, if you like, for the system to reconfigure itself is a deeper understanding of the nature of the problems we're trying to solve. And they are complex problems, and they require us to think in more complex ways. So this is a huge challenge, but I think systems thinking and systems innovation and systems working is the only way we're going to break out of short-term silos to more collective, holistic action that can actually make a difference to the population we serve.
That's great, Andy. Thank you very much. So some great points there. We're going to move on now in a sec to questions and comments, but maybe I just pick up on one or two things there, right? So you're saying, yes, there needs to be this informed understanding of what's really needed, and that needs to be the attractor for guiding the system. There also needs to be a bit of vision, right? There needs to be a vision. But then, yeah, you paint a kind of clear picture there of like, yes, there's got to be this informed decision, this vision, and then we've got to kind of work backwards in terms of how do we get together across our boundaries and overcome the real constraints and work towards. What do you think's okay? We see that. What's needed to do that, and why didn't it happen? What do you think? Yeah, what
Is
do
this to
you
me?
that process, right?
Yeah.
Do you see that happening, or why isn't it happening in the way that we would want to?
Well, as Yuk said, I mean, I think one of our challenges now is taking theory into practice, and Yuk is doing absolutely amazing work. And what he's also, I think, distilling out is that even everything that I said is true, and we get systems to want to work together, that the infrastructure that lies underneath the water, if you like, the operating model that's so Horizon One centric, needs to be re-engineered to make this possible. And there's a huge amount of complexity and hard work in there that's often not seen, as Yuk said, just by getting agreement of the direction of challenge and what needs to happen, actually making it happen, sort of reprogramming the infrastructure that's so optimized to Horizon One to support and enable that journey is in of itself a whole complex area to look at. I think the pressures of Horizon One, like everyone's got targets to hit, we've got patients to see, we've got things to do. It's so easy, even if we go through this process, to be sort of pulled back into trying to do everything differently in service of Horizon One, because that's so deeply entrenched. But by doing this Horizon 3 and Horizon 2 thinking, it allows us to start thinking cleverly about, can we solve some of the burning fires in Horizon One, not tactically and making Horizon One ever more siloed, but can we strategically solve some of these problems while also laying the foundations for something transformative? Can we be smart about how we solve today's problems that lays the tracks down, if you like, for more integrated systemic ways of working? But if we haven't done the thinking about where that goes, we won't know how to do that. We'll just bootstrap more Horizon One and
Yeah.
we'll be stuck.
So there's got to be the vision, the Horizon 3 kind of vision. There's got to be some kind of process to try and take us there, but there's also a lot of work to be done underneath the hood in terms of the real constraints that people experience to
Yeah.
move us forwards. Yeah.
One quick addition is that I have had some success, right, put that in quote marks, because things can always go sideways very quickly. But the work I've been doing with some of the ICBs, especially Suffolk and Northeast Essex, now becomes Suffolk and Norfolk, sort of facilitating Three Horizons workshops that bring council leaders, hospital leaders, primary care, social care, mental health, and community leaders into the room to say, is our journey just about polishing our silos? Is that the limit of our ambition of innovation, or are we going to come together around, could the whole be greater than the sum of the parts? What would that look like, and how do we get there? And how do we mobilize a whole system of collective actors around a new story? And I've
Yep.
done a similar thing with the hospital trust. So there is interest in this. There's lots of work to be done, lots of
Yeah.
models that would apply at different layers of bringing that alive. But there is interest, and I think this is our moment.
Yeah, but it's got to be very realistic conversations, right? Going up against the stuff that's really holding the constraints back. So quickly, Yukfeng, over to you before we go to some questions.
Yes, I just want to build on that because I see a huge connection between what Ushma was saying about language, right? There's verbal language, and there's a lot of issues in there in terms of love, power, and justice issues when people talk to each other in a certain way, with or without psychological safety. Then there is the visual language, which is the systemic visualization I was talking about. But then Andy brings a very interesting point about Horizon 1 and Horizon 2 and Horizon 3, right? So that kind of mitigate the worry that we need to transform immediately. It brings safety to the conversation. It helps us tease apart the power issues of who is powerful in Horizon 1 and who is powerful in Horizon 2 and who is powerful in Horizon 3, and that we don't have to get there in one step, and what is a safer conversation and a more meaningful, a more identity protecting conversation that we can have, right? So I think that we are kind of like trying to solve this problem in the same way, but using different methods, So which brings me to the point I want to make about the skill, right? So earlier I thought I talked about leadership and that leadership need to embrace some of these new skills. But the other thing I think really, really helpful is to Ushma's point about people who know how to use language and teach language and show the way with safer language that helps to bring people together. And two, to Andy's point, facilitators who can facilitate both content and process. Because if you want to separate issues from Horizon 1 issues and Horizon 3 issues, you need a content facilitator to be able to tease that apart. And that content facilitator needs to bring out the love, power, justice dimensions in the language in a safe way for people to participate. And so in addition to just leadership doing their work, I think a huge investment is needed for this complex work into facilitators with that skill. Yeah, and we build people up, like what you guys are doing, right? There's a huge amount of facilitation skill that is involved in bringing people together to convene in safe spaces.
Mm. And it's program design. It's not just facilitation. It's also, long-term programs over a year or a few years need to be designed and developed and brought into the world and facilitated, as you say. Ushma, would you like to pick up on anything briefly before we go to questions? Yeah.
No, nothing. Just I completely agree, and I did want to say something that I now for.
We can come back to it. Yeah.
Yes, sorry.
So, Roma, do you have any questions you want to pick up on?
Yeah, we have a couple of questions from Zoom as well as LinkedIn. I'll pick up on the ones on Zoom first. So, from Brandon Bell, we have a question. How can we meaningfully engage groups across all levels of interactions with the system, including those who face structural barriers like education, financial, or otherwise, to understanding both the system's present and future forms and their position within it?
Well, I'll have a crack at that. There's multiple ways of answering that, but one of the approaches that I've seen is necessary. I've talked about this sort of nested systems that we're involved in. If you're working in a GB practice, or you're working in a particular clinic, which is embedded in a hospital, which is embedded in maybe an ICB, which is embedded in a regional system, which is embedded in a national system, which is embedded in maybe the interest of policymakers about health. We've got nested systems that are really important. And what I've seen from my work is that in some ways, we need to address all of those systems simultaneously, because the risk of not is that if you're trying to bring innovations in at any one level, you have antibodies but above and below you, trying to get you back into the Horizon 1 model. So there is a need, which I've been trying to do, and I know others also, to think, we're up at the policy level. How do we think about funding healthcare not just as the cost of the sickness system, but how do we create the incentive and policy landscape that generates health for the population? And there's not just cost associated, there's upside of that. We know huge amounts of people are working with presenteeism, not absent, but present. Up to 70% of people are struggling at work with mental or health or stress or chronic conditions. The whole economy is suffering because we've got sickness. The vitality of our communities and our families are suffering. There's so much upside to be won of being able to create maybe a policy to make the UK, for example, the healthiest place to live and work. Now, that'd be an interesting policy. And it would invite, what do we do about food? What do we do about education? What do we do about the quality of the housing and the environment? It brings everyone together around a bigger prospect. Now, if you get the incentive landscape and policy dropping down into the ecosystem of actors, you've got life sciences and technology, you've got councils, you've got health, you've got food industry who sit in their silos but now being invited to come together. There's new possibilities through Three Horizons doing stuff there. If you come down another level and you're into regional health systems, you've got what can we do to contribute to that bigger story in our system? You come down to a hospital, you come down to a clinic, you come down to an individual. That way of thinking invites people not just to optimize the stuff I'm doing now, but each level is participating in a bigger story. And the possibility of releasing the innovative, creative, caring capacity that's stored and locked inside of bureaucratic structures makes possible, I think, radical and sort of seismic change is possible, but it's going to require that level of thinking and permission and ambition and creativity at all levels to unlock the possibility spaces. And in there, there's so much that the system tools and system capabilities that we've been talking about can provide the tools on the ground to help that thinking and action spring into life.
Yeah, and I think in the question was also about the kind of the breadth, the inclusivity, like across different socioeconomic economic kind of levels, right? Because yeah, inside the system, people are paid to be there in their job and everything, but you know that there are many others who aren't included in that way. How do you bring those voices in? Yeah, maybe Roma, back to you. We've just got 5 minutes for another
Sure.
question.
We can take one more question from
Maybe
Salim.
should we
Yeah.
pick up on Tom? Tom, do you want to unmute yourself and ask your question now?
Yeah, just great session. So thank you so much, Joss, for putting it together. Really enjoyed it. So I've got a question here. Well, I'll read it out actually because I put it in the chat. I've said the dominant healthcare innovation paradigm is quality improvement. So that's great if you want to polish Horizon One. So kind of that's where the mindset of the system is, I would argue very strongly. And great to hear you, Andy, talking about the three horizons. I'm a great fan of that. But actually, it's how are we doing enough to visualize possible future states, Horizon 3? I always find people in healthcare find that conceptually quite difficult to actually imagine what that could be like. And it's not surprising because it's kind of quite a shift. Everyone in healthcare is so hardwired to solve problems quickly. That's the kind of the dominant thinking mindset. I'm married to a clinician, and I use the kind of double diamond very often to explain that you've got to do discovery before you define the problem, before you develop the solution, and before you deliver it. And my wife turned around to me the other day and she said to me, Tom, do you know what your problem is? You've spent the last 30 years in the first diamond. I can go through both diamonds 6 times in 1 hour. And that's because she's a healthcare clinician, and that's the way you have to work if you work in healthcare. So we're kind of so we're trying to bring these ways of working into a culture which kind of works in a very different way. So my question is to anybody: what are your kind of top tips for building that skill set, getting people to kind of hold back from instantly delivering solutions? How do you kind of get people to step from Horizon 1 into Horizon 3? What drugs are you giving them to facilitate this shift in thinking?
Well, I can give you a very quick example of how I've applied this in a hospital trust, actually down in Devon, Torbay in South Devon. I worked with the executive team and the board to do this three horizons, basically to get the common agreement within the team that if optimizing what we do now isn't going to improve the health of the population, in fact, we're just going to lead to the deterioration because we're fiddling with the sickness and we're not dealing with the health. And with the permission now being given through the 10-year plan to become integrated health organizations that can be in the community, let's look at that three horizon. What would it look like? What could embedded neighborhood working look like? Who would we need to partner with? How might that work? And how that might be an opportunity to support more people earlier on in their disease journey, to support people to stay well and provide the ability to warm handoff into acute settings if needed be, to be managed holistically and then warm handoffed back into the community. So we actually put what would need to be true and start to develop some sort of picture of what a future health system would look like. And then we work through, well, what are the key signature moves that we would need to make to get there? We need to build that capability, build those partnerships, build that kind of system. We'd need to reimagine acute to be less individual specialties and more holistic, multidisciplinary working that could have this warm handoff to and fro. We'd need to have a new way of talking to the public and engaging them. So what would that look like? We need to take our people on a journey of transformation, be able to operate clinically and manage those kind of relationships. So we had a bunch of kind of signature moves that describe that. And then we look, well, what are the key enablers? We're going to need to train our people. We're going to need to have a new holistic way of thinking about IT and data and how it moves around. We're going to have to think about how we move budgets and money around to support this. So what are the key, speaking a little bit to some of the work that Yuk has gone way more detail on, what the operating infrastructure of our system will need to change and evolve to support this. But by putting enough sort of meat on the bones, if you like. You give people a substance to do that. And the way that we did that was running workshops with emergency care, running workshops with elective and planned care in neighborhoods to have their three horizons thinking augmented onto this model. So it was co-created by the people who are participating in the system. And then there's more energy that comes if people have invested in building it from their own perspective. And so that's one way of doing it.
Yeah, collective vision has to come from individual vision, but you're going back to facilitation there also, aren't you? Again,
Yeah, exactly.
It doesn't happen by magic. So we come to them, but Ushma, I'd love to just quick word from you because it's kind of what you're working on, Horizon 3, and introducing a different language around healthing. Would you like to say a quick word?
Yeah, sure. And maybe also just to add to Tom's question as well, I loved your conversation with your wife as well. But to build a bit on Andy's answer as well, I think we need to create environments to break free of today's Horizon 1 constraints. So that also means like our day-to-day stress, my vested interest. So I really liked, Andy, you mentioned I basically need to look at how I can improve my own silo within my time frame with my pocket, my budget, right? And so in order to think outside of that, we need to create environments where I can step outside of it. So perhaps even things like, and I think it comes back down to facilitation as well, different location, etc. But I also noticed that in some conversations with people, I, in a way, pushed them not forcefully, but like guide them toward the kind of breaking point of, oh, I cannot solve that anyway. And that's not my responsibility. So it's like a breaking point there that's outside of my system boundary or my responsibility. And then slowly think about, well, is it not your responsibility because you are a human? You are with privileges, you have responsibilities. And what do you want as a human to, and then you guide with them with that to Horizon 3, right? What do you envision for your future and for your future and for your family's future, right? And then kind of come with the humanity and kind of morality argument. Like we go really to the basics of, why do we exist in a way to get them to think about Horizon 3. I think that's another way that I've even found very stringent corporate people to think a bit more about more openly about Horizon 3.
Yeah, it's a journey. It's a journey, right? Yukven, would you like to have the last word? Yeah.
Very quick one. I found the conversation very interesting about meaningful engagement, and it's linked to Tom's point about what's the magic drug. I think it's important for us when we listen to people's stories, and we should encourage people to tell stories from their perspective of how they're experiencing not just care, but the stories from the staff, which Andy is talking a lot about just now, right? We listen to that stories, and our job really is to close the loop on that and then make sure that it's meaningful to them when we come back to them. That is meaningful engagement. So leadership at different levels need to close the loop on the stories and make meaning. And don't ask people to keep telling the same stories over and over again. No, so that on that magic drug, right? I think Tom, in my view, in addition to everything Andy has said about workshops and bringing people together to have those meaningful exchange, I will add one thing, and that is people with lived experience. If leadership says bring people with lived experience into the room, and not just for the care, but in governance redesign, in indicator selection, in target setting, in data modeling, right? What is the data that you guys are using to make decisions in those conversations? Then you have both, right? You have both the human part in that drug, in that room, the human part. Then you also have the technical models, the people responsible for making those things, designing the systems that actually work, listening to people with lived experience on what they need scaled up for them. What is the experience you want? That will help us faster close the loop on meaningful engagement, which is what Brandon is talking about. I think the system is full of people wanting to do good, right? We need to find ways to put that skill into the room and use it, and leadership has to acknowledge that this is something that is doable. Yeah, so I'm just going to stop there.
Excellent. Thank you very much, Yukfeng, Andy, Ushma. Amazing conversation. I think we really drew out some really core challenges and issues here, and where we are and the complexity of the challenge that's ahead of us and that people are working on. So excellent conversation. We're over time already. Could have stayed going, but I'm going to pass it back to Roma to wrap up. We have a link in the chat if you'd like to jump onto the mirror board to provide feedback. That would be wonderful. But over to you, Roma.
Sure. Thank you so much, everybody. That was great conversation and a lot of great insights. Thanks to the wonderful panel we had today, and I see a lot of interesting contributions in the chat box and also on LinkedIn, Zoom comment section. So thank you, everybody, for the participation. You could join our space, healthcare space here on our website by clicking on this button on top, so that you know about our future events and find all the resources that we share. And we're also on
To wrap up,
LinkedIn.
we have.
I'm sorry. All right. We also are on LinkedIn and YouTube, so you could click on the links over here and join us there. This particular video will be available on YouTube, LinkedIn, and the website. Now it's time to get your feedback. I'd love to hear how useful was this session for you. How was the experience between 0 and 10? 10 being it was very useful. So you could select a dot of any color you like and place it on the horizontal bar between 0 and 10. And if you have any additional notes for us, please feel free to write them on the sticky notes and find the paper over here. It's also hyperlinked. So thank you so much once again for joining, everybody. Hope you have a great rest of the day and week.
Excellent. Take care, guys.
Thank you very much.
Yeah, thank you.